Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on Montelukast or Singulair. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing to discuss here is what Montelukast is used for. So Montelukast prevents and treats asthma. It also prevents exercise-induced bronchoconstriction and treats symptoms caused by allergic rhinitis or hay fever. We'll now discuss how to use Montelukast. Your doctor will tell you how much to use. Do not use more than directed. Read and follow the patient instructions that come with the medication, and talk to your doctor or pharmacist if you have any questions. Now, what happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, skip the missed dose and take a regular dose. Do not take extra medication to make up for a missed dose. If you're using the oral granules, do not open the package until you are ready to use it. You can give the granules in 3 ways. Put the oral granules directly on a spoon and then into the patient's mouth. Mix the granules with baby formula or breast milk that is cold or room temperature. Be sure not to mix with any other liquids. Or mix the granules with applesauce, mashed carrots, rice, or ice cream. We'll now discuss some warnings associated with this medication. So tell your doctor if you are pregnant or breastfeeding, or if you have liver disease, or a condition called PKU. Tell your doctor if you have a history of depression or mental health problems. This medication will not stop an asthma attack that has already started, so your doctor may prescribe another medication to stop sudden asthma attacks. This medication may cause the following problems: changes in mood or behavior, including agitation, aggression, depression, sleep disturbances, suicidal thoughts or behavior, increase in certain white blood cells which may cause blood vessel disease. If you use a corticosteroid medicine to control your asthma, keep using it as instructed by your doctor. If any of your asthma medications do not seem to be working as well as usual, call your doctor right away. Do not change your doses without consulting your physician. This medication may make you dizzy or drowsy, so do not drive until you know how it makes you feel. Over the next 2 slides, we'll go over some adverse events or side effects. If you experience any of these, you would want to get in touch with a physician right away. So if you had an allergic reaction which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing, if you had blistering or peeling or a red skin rash, chest pain, fast pounding or uneven heartbeat, fever, chills, cough, runny or stuffy nose, sore throat or body aches, if you have numbness or tingling in your hands, arms, legs, or feet, pain and swelling in your sinuses, pain, redness, or swelling in the ear, restlessness, anxiety, irritability, mood or behavior changes or thoughts of hurting yourself or others, if you had sudden and severe stomach pain, nausea, vomiting, and lightheadedness, or lastly, unusual bleeding or bruising. Alright everybody, that's all we're going to talk about today with Montelukast or Singulair. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.